Very good evening for today, my beloved colleagues. Welcoming all of you to today's very special and technical session, rather to say. And you can remember that most of the time we are sitting together to discuss a topic. So, for example, any system or other the medical subject related topic directly. But intentionally, we are here today to discuss the technical plan of your exam preparation. I'm not sure how many of you appearing in coming immediate exam, but most of the time we found that the colleagues are telling, I have short time, what can I do now? For example, we plan for the candidates by considering the different categories in different time slot. Some doctors, we remember that those who are utilizing the module, some of them are using just the minimum time possible, that is around 4-month duration of subscription. Some are 6 months and some are 12 months. So if you follow our group, you could understand that we actually divided the candidates category into 3 groups. Those who are advanced, they prefer 4 months. Those who are beginner, usually they prefer 12 months. But here, what we are thinking that in coming exam, your time is very short and very less time in your hand. And many often we got the question from many colleagues as personal inbox, but we are thinking that to discuss together in a group so that each of today here can help each other by sharing our experience and what we have to do. And interestingly, there was a problem of the application procedures and others. So far, I have the latest informations, maybe within 5 August is the time to inform you for the confirmation of your application acceptance. If I'm okay, just can anyone help me that was it right and you got your confirmation? Anyone, please? Dr. Javed, please.
Yes, Assalamu alaikum, Dr.
Walaikum
Usman.
Assalam. Yeah, Dr. Javed. Did you get
And
the time?
Usman, I think it's the 29th August. They will
Oh,
inform.
I'm sorry. Possibly I was wrong. 29th August. Oh, that was initially maybe 5 September, maybe like this.
Yes, initially they said 5 September, then another
Oh,
email came, they said,
yeah. Thank you. Thank you. Yeah. In another notification. Right. So we have to wait. Still, there is a trouble of technical issues that we need to wait that am I going to appear the exam or not? And it is a matter of confirmation in future. Does it mean that I will start that I will be confirmed, then I will start my study? Practically, no. Because your learning will be a long time process. Not that you just got signal, green signal, and you will start your learning. And the syllabus, component, everything, it should not be very minimum that any 1 month and 2 months in our hand and I will be able to prepare myself. It is very impractical. For this reason, many of the candidates I know that they started their journey of preparation few months back. For this reason, we are confidently telling you that some doctors preparing on an average, I think the 6 months subscribers are more with us. Even then, we tried our best to guide you as minimum 4 months overall, preferably those who are almost advanced candidate. Advanced candidate means possibly you have some academic career degrees in some other subject and you are sincere and you can pay most of the hours of the day in the study. Then it is around 3 to 4 months. It is 3 to 4 months. But if you think that, okay, within 2 months I will prepare, I think practically it is not much possible. And today I told you that the very technical discussion we will have now with us. And we like to highlight today the module, what we prepared. You can see that already every one of you could see in the group that this is the module we prepared and some of you are utilizing. and some are in direct contact with us also, that you are having some little trouble or understanding issues, and we are trying our best to correct as early as possible so that your study should not be interrupted. So those who are using the module, I'm requesting you to inform us that have you having any the trouble to utilize it, one. Second, as today's targeted topic is to prepare yourself within the short time. So I like to introduce my talk today by saying that always short way, there is a chance of danger. For example, if you want to cross the road, directly over the road from this side to other side without passing the foot over bridge, there is a chance of accident. But you could pass the road, no problem. But keeping in the mind that there might be accident. Even then, in our life, some point of the life, we need to be hurried. We don't have enough time. We are human, right? Not only preparing the exam, we are having families, members, jobs, many other responsibilities and commitment. For this reason, we need to have only the shorter pathway. And it is also true that by crossing the road with a short path, candidates can get their success also. It is true. So this is our highlight today. And if we like to show you our module here, this is the content of these. Many things are there, but the main point is we have given the preparation time in a time slot. For example, if you start from the cardiology, but you see there are some clicks are there. Only a few hours is enough for this, just technical informations. And those who are not beginner, you don't need to read it. For example, these are very primarily those who are attached with us. You already finished it, the basic technical informations of the exam. So those who are preparing yourself now, no need to read it, these materials or others. Already you know, and we are very happy that most of you know attending our regular sessions. And most of the time we are giving you some technical messages, technical understanding. For this reason, these are not needed. If we start with these in this way, topic wise, system wise, we will try to give you the technique how to read it from our experiences. Don't think that it will be the best one, but it is our what I say, accumulated experience, the extract of the accumulated experience we are telling to you. You can interrupt and you can share with your views also that it could be possible in another way, no problem. So I am requesting all of you to be with us until the end to get the benefit by ourselves as well as to share the benefit with other colleagues for the other friends advantage. Anyway, so how to start with this? For example, the cardiology and dyslipidemia. If anyone here, those who are using the module, just to share the experience with anyone, can share with us and open your mic. Actually, how did you study with this from here? We proposed, anyone please open the mic until I'm talking. Anytime you can open the mic, please. Those who use the module and give your experience about the cardiology. And the cardiology, I think that it is very open button for almost everyone. Without even the subscription also you could see. And we told that this color, greenish color is open button for everyone. So for example, the cardiology usually is a bulky topics. And usually we feel better to start with the cardiology for each module, for the MRCP, MRCGP as well. So in the cardiology, nobody here, if nobody here, may I request Dr. Javed, please, just to
Yes,
share
sir.
the experience. Always we found you very positive, with very positive attitude to help other as well. I think you will feel better also to talk with me now.
So,
Regarding the cardiology, Dr. Javed, I believe that you finish your cardiology part in the meantime, is it?
no, I started from the weaker portion from me when this woman
Oh,
health.
wake up portion. This is another
Yes,
technique. Yes, we can discuss it also from the another
cardiology.
technique.
My cardiology is pretty good, so I thought I will do it in the end.
May Allah help. May Allah help. So any other colleague, Dr. Javed, you just be connected if possible, as much as possible.
Technique is the same.
Any other colleague to be with us in the discussion, just to guide you how you will proceed, especially anyone also, anyone, more or one or two candidate can open the mic, open the audio to talk with us. Just to explain you, because we didn't take enough time to explain the module in a greater way, just given the glance of this module before. For example, you see here, the view lecture, that means we took the lecture before, we recorded it, and you are listening. And Dr. Javed, possibly you know another also, that around our lecture near about 2 hours, right?
Yes.
90 minutes to 120 minutes around in general, just to view it. So in a day, if you divide your time for the preparation, for example, you have how many days now, Dr. Javed, ahead for the exam? Maybe 3 months plus some days, is it?
3 months plus 10 days, almost
Yeah,
100 days.
almost 100 days. So if you can start with with a 100 days journey, how to make it possible for us to prepare? Apparently, if you think that the cardiology, we actually given the time 1 to 6 days, considering overall 4 months. Possibly we told you in many occasions before. If you go down, you will see the respirology from the day 7 up to 10. That means 7, 8, 9, 10, 4 days. But here cardiology 1 up to 6. These are 6 days. Why the 2 days are more? Because the learning materials are more, especially the ECGs and others. And we included the dyslipidemia here, and the content of the subject is more. For this reason, we allocated the more days here, for example, 1 to 6 days. It is not hard and fast rule, more or less. If you can cover in this way, according to the allocated time, it takes near about 120 days, including your exam also, the recall, understanding, and other as well. But here, as we have only 100 days, we need to minimize our 4 months time. So how to minimize it? You just look at here. I'm sorry to say that some candidate is still thinking to start the journey, but some of you already started and you finish many of the parts of the module. So you could choose any system like Dr. Javed, where you are weaker. You can start with this. But for a structured discussion, we started with this now, the cardiology and the dyslipidemia. So here you see that we divided the ECG in different part. One is here optional master classes. It is not directly discussed in the context of AKT directly, but the basic informations are given there. I know some of you are master in your subject, in other degrees, MCPs and others, you already finished. Some of MRCP doctors also now appearing for the MRCGP. So they don't need to re-study this thing. So we made it optional. And this is our latest version. We actually included the word optional here. It was not written before, a few months before. So optional means if you know the main things, basics of the ECG, you don't need to go through it. For example, this ECG, again, near about 90 minutes minimum time, 1.5 hours. So 1, 2, 3, 4, 5 topics are there. So you see 1 to 5 means 7, near about 8 hours. So it may take again 1 to 2 days time from you. You cannot concentrate in a single day 7 to 8 hours. So at best, you could pay your 3 to 4 hours every day, and it may take 2 days. So we advise you better not to go with this one, the ECG master class, especially those who matured enough. Okay. But again, those who want to be beginner or mid-level preparation, with the mid-level preparation, but you are mentally adamant to appear in coming exam, and you need to know the basic also. In this way, you need to pay more hours every day. Otherwise, you cannot complete your journey. This is our suggestion. We have to think very practically. So, in general, if you don't go through the detail also, it is enough to prepare for AKT regarding the ECGs. So, we have given a separate button here. We sorted out the very common ECGs appeared in the AKT exam, including the OSCE also. And that was the button, ECG in AKT OSCE. Click here, then you will open. So we don't like to open now here. Again, other things are the cardiovascular overall. and the third point is dyslipidemia. So here you can save your minimum 2 days from here. At best minimum 1 day you can save. Not that you need to pay up to 6 days here. So from the 4-month study plan, that is from the 120 days study plan, you are saving 1 to 2 days in the cardiology. So how to start and proceeding? You already know that view the lecture, then lecture means in the right side buttons are there. If you finish it, then going to the relevant slide. It is just to see the PDF slides, including many other messages. And you are going to appear the question bank. Already you know, very nicely organized question bank we are having. If any doctor want to see the button, please, you can request us today also. Actually, our intention not to show you everything, just to give you an overview how to prepare in short time. And then you are going to attempt the mock, system mock. And system mock is a matter of 1 hour. 1 hour means you appeared the exam and you immediately get your score and you recheck your answer and explanation. So how many hours it will take? 1 hour, at best 90 minutes. Okay, then primarily you finished your journey of cardiovascular study. So I think you will be with the same opinion with me that if you say the view lecture maybe 2 hours at best, you might have to pause in between. And then a view lecture means in the one lecture cardiovascular, this is a 2 hour. ECG in the maybe again 1 hour or plus something, 3 hour to 4 total from here. Again, these again, if you think that with the 2 hours, so 6 hours here to finish your lecture. So cardiovascular minimum, you need to pay 6 hours. Now, how many days you will pay to organize your 6 hours? This is up to you. But for the AKT aspirant exam preparation, you are having with you now, so you need to pay some hours every day. Otherwise, why you are appearing for the exam? So these 6 hours can be finished within 2 days minimum. At best, you took 3 days, not more than that, not more than that. So if it is the 3 days, and then come to the solving this the question bank, it will take time because you need to go through all areas. For example, hypertension, ischemic heart disease, arrhythmia. It cannot be finished within 1 hour or 2 hours. It may take, again, for example, 1 to 2 days, 2 days at best. So if you pay here 2 or 3 days and here 3 days, including the mock will take only, I told you, 1 hour. So 1 hour and 1.5 hours. So it will not take more than 5 days at best. So if you are serious and pay a little more time, 4 days is enough to complete this cardiology, ignoring this thing, the optional part. Definitely ignoring this thing. And here also in the question bundle, this is an additional extra reading material. And we like to assure you that without these also your preparation can be finished. This part, this is only given, for example, you subscribe for the 12 months or 9 months, you need to enlighten yourself with additional materials only for you, not for the 4-month journey. Okay. So in the cardiology, you finish it this way and you just note for the further study and you can share in the WhatsApp group already. So similarly, for the respiratory part here, the same thing. So you see that in the respiratory part, the materials are not bigger like cardiovascular. So again, there is a master class, X-ray in the clinical practice. So it is not directly discussion of AKT. Direct discussion of AKT actually we have done here. In the X-ray for AKT or the OSCE as well. And if you open it, you will, some of you attended maybe before also. It will take a matter of 2 hours. And these are very simpler. You don't need to go through the detail. And again, one lecture. So how many days it will take? Maybe 1 day, for example. But again, you have to pay 1 day here minimum for solving the question bundle here. So though we allocated 4 days here, we request you to pay minimum 3 days and try to finish your respiratory material within the 3 days. And it is possible practically, and it should be possible. Otherwise, it will be very mature preparation with you, including the mock and other. So every system, we are not telling you, we just given you guidance how to proceed with the system. So you just look at that sequentially. The other systems are like this, not bulky, like I told you, like the cardiovascular. So I'm just scrolling up. Here in the endocrine, a little more material could be there. Weight, nutrition, and other extraordinary materials are there. Here, maybe I am telling that 15 to 20 day, 15 to 5 days. So here you can pay 4 days you target. But if you think that, okay, I cannot finish with these many materials, but it needs some time also to absorb. So you can actually proceed these with total 5 days. That means no need to save every one, sorry, 1 day minimum or 2 day from each system. If you think that you are weaker, like Dr. Javed said that you are weaker with the system, you can take the full day, provide it with us here, the 15 to 20. That means you proceed with the learning of the endocrinology and pay 6 days here. 15 to 20 means 6 days, not less, because subject matter is a little different. I believe that there are some technical things, some mathematic issues are there, some data are there, endocrinology and the metabolism. For this reason, we have given 6 days allocated days for you. So if you go down again, other system, nephro-urology, actually as a subject specialty, urology is separate from nephrology, but for the GP we combine together. Again, they are 4 days, for example. So again, you see buttons are not much, and then going down, skin, again a single system, and in the GP, skin is only you just go through the topics, look at the pictures, it will give you comfort. And we given a little extensive discussion. There are 2 lectures from the skin to make you understand the skin very easy way. There are some diagnostic approach. These are the basic thing. We advise to go start with this diagnostic approach, then go to the topics. It is better. Again, though we didn't write it optional, if you think that my time is very short, you can skip this. Minimum you finish with this skincare 1 and 2. Then go down as below, system mock and other. Then the rheumatology, again, musculoskeletal disease approach, it is a plus minus. You may use it or may not use it, but these are mandatory. Again, it's a matter of 1 day or 2 days. So we allocated here 29 up to 34. That means again 5 days here, because rheumatology, including there may be some orthopedics issues, and orthopedics are common. For that, it may be a little broader preparation with you. So including again the mock, so you can save minimum 1 day here, for example. 5 days, you can save 1 day from this system. So similarly, 1 or 2 days minimum, if you save 1 day from some system, you see again, neuro care learning material will be more. So I'm just scrolling down likewise. You understood the technique now, what we are telling with you. So there are maybe 20 plus systems are there. So if you can save minimum 20 or 21 days, so you can make your 120 days preparation into 100 days, what Dr. Javed said, near about 100 days. And at the last, if you come to the system mock, sorry, before going to the system mock, you can pay a little more time here for the women's health, because women health actually a bigger chapter, and nowadays it is very emerging. Maternal child health taking its lead in the general practice, and very recently we actually took more lectures and discussion with this. Near about, you see, 1, 2, 3, 4, 5 already your basic lectures are there, including some master class. Again, master class is not designed directly related with the AKT exam. You are, for example, infections in pregnancy, it is an extraordinary topic given to you, but you could get an idea the infectious disease in infectious disease chapter separately. So if you don't have time, again, you may not go with this. But here 1, 2, 3, 4, 5. So if you think that I will see only one lecture in 1 day, I like to say you that actually will not get proper preparation for your coming exam for 100 days journey. You need to pay minimum the time to finish 2 lecture from there every day, because you need to go through with the relevant slides, including the question bank also, for this reason. So similarly, if you actually save your time, you have to pay some more in the child health as well. A little more topics are there for the child health, including child surgery. But you see, elderly care, very smaller topic. A smaller topic. For the elderly care, we allocated 4 days. 4 days, maybe we could edit it later, but I think within 2 days it is possible to finish in the altar. But osteoporosis, a later part is there. For that, we try to give you a little more time. But I believe that minimum you could save 2 days from here. 2 days from here. Anyway, other miscellaneous issues. Miscellaneous is miscellaneous. A lot of things could be there, and we will improve it in future also. Many other extraordinary topics we will add here. But for AKT purpose, we didn't put more button here. Lecture 1, with including these topics: preventive health, promotive health, ethical, legal issues. Maybe 1 or 2 questions will be available according to these headlines. And if you finish this way, including some other miscellaneous also, clinical pictures. Very interesting topic, you understood. And interestingly, these are open button. So those who are user of module, even not also, I believe that you could open before these clinical picture lectures. So you don't need to pay extra time here. It is only as a part, and to complete the module, we put it there. Those who attended before also, you don't need to open this button. Okay. So in this way, as I said, you 20 to 30 days you could save. But if I say you that minimum you could save 20 days from this module, still you have enough time. Enough means adequate time to prepare yourself for coming AKT exam. And these are the system mock set 2. So we given one system mock with each system for your primary preparation. This is a separate set of the mock exam, and it will be your final preparation at the later part. For example, if you finish your journey from today onwards, for example, with the 90 days up to this, according to the system and other, so keep remaining 10 days. I'm telling 10 days for you, those who are having very short time in your hand. Still you are thinking that how can we start, how can we start? So last 10 days, be with your time, take your leave from your job. I'm requesting all of you, most of you are doing your job in your place, but doctor, to achieve the success, we need to pay attention to get it. This is very true, every sphere of our life. If you want to earn money, you have to be busy with the process to earn money. If you want to earn knowledge, you have to be busy with the knowledge. If you want to achieve your degree, you have to be busy with the degree achievement for the preparation. It is very, very fact. So minimum 10 days, if possible, more than 10 days. So within the 10 days, if you have around maybe 21, so far I can remember, Dr. Javed can help also to me to say near about 21, maybe so far I can remember, there are mocks, system mocks only. So one mock will take 1 hour, and then 1 hour or little more, and then you can go through the answers and discussion. So 2 hours, for example. So before the exam, you need to pay almost whole day for your preparation. So try to finish minimum 3 to 4 mock in the last 10 days. Again, I'm telling, not for all of you, those who are very short time and you like to start from today onwards. In the last part, minimum 3 to 4 mock you have to finish. In this way, so within 6 days or 7 days, you could finish the system mock, and then you will be prepared for complete mock, every day one complete mock. But before one day, you just put to review the recall questions. So we divided the recall question in this way, and you just listen and then. So keep minimum 2 days for the recall, finish it, and then go for the complete mock in the last day, 2 or 3 days before. I don't know how much I am able to make you understand your short journey with the AKT module with us. You may have different module or others, no problem, doctor. Actually, as we tried our best to develop a best one, we tried our best to guide you how to proceed, especially those who are using with our module here. So this is my very primary talk until now, and any other colleague to tell us, to hear from you now, Dr. Javed, Dr. Nasir, or other, any colleague, how can you tell and how can you guide us and share your experience to proceed with? Any colleague here to share, please? Session is open now.
Hello, sir. Assalamu alaikum.
Salam. Yes, Dr. Nasir, please.
Sir, my humble suggestion also is like this, this mock exam better to finish both mock exam at the same time. For example, if we are doing CVS, so we finish the CVS mock which is available in the main and
Okay.
in the end or also. So by this
System.
way,
At the end of system, you mean?
yes,
That means the second set of mock.
yes,
That is also good idea. That is also good idea. And you will feel free. You will feel free that
yeah,
I finish this topic. For example, before this one, I think you're meaning this one, system, the set two. Okay. So
yes, sir,
for
yes, sir.
cardiovascular and dyslipidemia, it is also possible. It may be individualized, no doubt. For example, if any colleague here that you attempted before, previous AKT, some of you I know that you attempted before, unfortunately you couldn't pass. So you don't need to go through every details. For example, the second, what I say, if you come here, the second option, this material, no need, no need. Even you finished your question bank also initially, and it may not take long time for you. You just rapid reading is enough. For in this way, what Dr. Nasser said, that if you go through with this, for example, the elderly care, so there is a one mock. I think all of you understood what Dr. Nasser said, the attempt system mock, and then note for the query and try to solve the queries and discuss with each other. Already some of you tried to put in the group also. We tried our best to solve it. And then come back to the there. I think Dr. Nasir's meaning this system mock and click the system there and then it will be
Yes.
finished. I think it will be relaxing if it is possible. You are right, doctor. It is right. Thank you for a good suggestion. Any other colleague to put any other suggestion?
Excuse me,
But what
Dr.
you yes, Dr. Javed, please.
System recall, we will do at the end after finishing everything. This
I am
view
also,
recall.
yes, I am also with this because if you start technically system recall earlier, you will be very tunneled vision. Your vision will be very tunneled. You may not think beyond this, but it is not enough. Though it is very useful and marvelous, and near about 30% question actually in each everywhere in the world. It is our experience, not only here, even the MRCP and other exam. Usually they touch these recall question near about 30%, almost as it is. And even in the last experience, some colleague also said us that, doctor, we saw some question as it is from the recall discussion. It is true. It is not that this is our magic. I'm sorry to say. This is the system. Usually they put. But considering this thing, there are more than these. So this is a good idea, Dr. Javed. I agree with you. System, the review, the recall classes should be seen just before the complete mock, or even you can see after finishing the system also before the second set of mock also. Okay, what Dr. Nasir said to put it up, again you can modify here that after finishing all the system, you can come to the this what I say, recall session also if you want. Yes, Dr. Javed, thanking you. Any other suggestion, Dr. Javed? Suggestion means what you are thinking for you can share.
Dr. Nasir, I think modified something. I agree with him.
Okay.
We can finish system wise.
Okay, right, right,
So
right.
we'll, I mean, if you are able to do that, so
Yes,
then I think this system recall, I think we can put for the last 2-3 days,
yes,
last 4 days, maybe you can say.
yes. But what we like to say at the end, try to keep the day before exam only for relaxation, not to read too much.
Absolutely right. Yes,
And
sleep.
we
Next.
always we actually keep our eyes over you in the group, and we give a short suggestion 1 week before the exam. Put 1 day minimum before the exam day just to be relaxed. This is very practical. And in our previous life experience, even from our studentship, we were very busy to rewind our study and other. Actually, it is fruitless. It is only give you some false relief in the mind that I am reviewing everything, but valueless. Whatever you gathered, it will be stored in your brain. In this respect, I like to tell some neurolinguistic issue, how memory is retained. And many months before, actually, we took a discussion how to improve your memory. I don't know, it is available in the YouTube now, before the MRCP preparation, before we took it. Repetition is important. Recycling is important. Not that you are just going through newly something and you will put it 2 days later. It is not effective. Maximum your memory will be in your brain for the 6 months if you don't touch it again. You can remember, Dr. Javed, another, the memory cell, how memory cell developed in the immunology. Okay. Initially, there is no memory cell, right, for the immunology. And then some memory cell develop in the later time, second infection, memory cell will be more stimulated. Memory cell means I'm telling memory T cell. Similarly, in the brain, the center of the memory will be utilized in this way. If you knock the memory cell more in the brain, I'm not telling lymphocyte, for the memory in the brain, it will be stimulated more so that you can remember for a long time. This is very, very fact. And you can remember that in your childhood, something happened in your life. It was very interesting. It was knocking or shocking in your life. You will never forget. But what you have taken in the morning with the breakfast, you might forget. Dr. Javed, am I right? You cannot remember what you took in the morning because you are very busy to go to your office. This is very fact. Even you cannot tell me now how many buttons with you in your shirt today. Dr. Javed, can you tell me if you are wearing shirt today? How many buttons with you?
No,
No, nobody
I
can
think three,
tell
three
almost
buttons.
because the reason is we never count our button because we are not bothering it. But we are buttoning and unbuttoning our shirt every day. So our memory work in this way in the brain. If you give attention there, it will be stored more. And if you knock there, if you storm the memory, and it will be retained more. So you need to repeat it, repeat it, repeat it. This is the way. For this reason, actually, we try to give you the information in different ways here. Okay. For example, we discuss the system mock. Okay. Again, you will get the same topic. Sorry, I like to start with the lecture. For example, we discuss the topics in the lecture or group discussion. Again, you are appearing the same thing in the learning slide. That is, learning slide means what we say, relevant slide. In the system, you see relevant slide here. Almost repeating this thing. Then solving the question bank. You see, in a different format, you are repeating this thing, relatively little more topics here. Again, you are coming back to attempt to the system mock. The same thing, almost same thing, a little more issues. So how many you are repeating? 1, 2, 3, 4, right? 4. Again, finally 5, that you are noting some queries and discussing to each other. This is the way of learning stepwise. And that is our target, to guide you in a structured way and giving you the arrow. Okay. Our humble suggestion is actually to follow the arrow, not randomly something you appear in the mock fast, then go back. It will be very exceptional for you. But this is a method we are following structurally to guide you. Okay, this is the way. And we paid more time, those who are following us for a long time, to prepare this module. Okay, it is a very dynamic and rather to say enriched module. It is not simple PDF. Okay, for example, you are getting some past medicine learning materials in the online. Some even yesterday maybe or today morning, one colleague asked that, Doctor, I'm using the past medicine, is not enough. Actually, I like to address Dr. Nasir to answer it, because Dr. Nasir was following us long time. Doctors are asking, is the past medicine learning is not enough? How will you answer, Dr. Nasir?
Actually, sir, my answer is no.
Can you explain it? Can you explain it?
Actually, sir, it is outdated. It is any past medicine. There is no more question, no advanced question they are putting in it. Since 4, 5 or more years, the same question bank is there. And as far as the AKT is concerned, they are increasing or enhancing their question with every tide. And
Right.
actually, Your module is more than enough. Your course, sir. One question more.
Please.
This slide, relevant slides. It is mandatory because it looks very nice, but it takes so much time to me to cover all the slides.
Okay. And after responding your comment regarding the past medicine, then please pick up me again if I missed to give you the answer. Dr. Nasir, be connected with me 1 or 2 minutes, please, so that I shouldn't miss. First response of you, comment of the past medicine. That actually I know about it, past medicine, on exam or past test, whatever the learning materials, because we were used to use the materials when I myself were preparing. Actually, no more mentors and others surrounding us. Suppose the decade before, only the learning materials are there in the online past medicine. Even past medicine is the youngest. I remember past medicine, the initial was, it was emrcp.com. I think most of you don't know it. And it was a very free website. And myself used it. Later on, when they come into the market to commercialize, they modified their name, pastmedicine.com. So it is available for the MRCP as well, anywhere. These are very less interactive material. Less interactive means they give you only the text and other thing, and you are preparing some mock or some discussion materials only to get the PDF and others. Initially, it was around, for example, less than 2,000 question. 1.5 thousand to 2,000 question for MRCP or as well as MRCGP. And day by day, they're increasing. But if you ask yourself, was not enough 1,500 and 2,000 question for preparing the exam? I think it was enough. But why they're increasing more questions there? Though Dr. Nasser claimed that they are not increasing in others, I am telling a little differently. Increasing question is not actually purposing the serve of acquiring the knowledge. It is only expanding the informations, not the technical knowledge, because disease is same. Okay, and the development in the medical science, especially happening in the management and others, with little investigation issue. But the basic concept of the disease understanding, immunology, basic thing to utilize in our understanding level to how to deal with the patient, these are very basic and these are the bulk thing. For this reason, as a family physician, how will you deal your patient? The main part of the things are not changing too much. For this reason, 1,500 or 2,000 could be enough for this. I am just telling a little differently to Dr. Nasir. But increment of the question may be serving a commercial tendency to give you more messages, more questions and others. For example, for the single topic, management of hypertension, 5 to 10 questions almost enough. Those who attended our hypertension classes, you can imagine, even we can repeat the topic also in future by the mercy of Almighty. If you look at the hypertension, just basic thing and management part, for the very basic, according to the guideline, you are answering what will be the drug of choice. But considering the comorbidities, considering the etiology or what I say, complication of the hypertension, your drug choice will be changed. So get this thing and to understand this thing, maybe 10 question enough. But you will see that in these authority, those who are providing the question in online as a commercial basis, they have given you 50 question by accumulation. So at best, you can say that there may be new concept. You can add 5 question more. For example, I am telling. So it will be 15 question. But why will you go through 50 question? Because this is their bundle. This is the attitude. If you don't understand the basic thing of management purpose for the hypertension, even you are given 100 question, you will not acquire your understanding. Dr. Nazar, where are you, please? I think you understand and all of the colleague understood the message.
Yes,
So,
sir. And sir,
yeah, sorry, please.
yes, sir. And sir, they are not any focus. We cannot do focus and guidance from the past medicine.
could be there.
यानी
I better, doctor, not
and
to tell
focus and
the
target.
negative thing, because we are benefited with the past medicine or other companies, no problem. Just for practical purpose, we are discussing. As you mentioned that here, Dr. Nasser, I appreciate you and grateful that you are following us for the long time also, like other colleagues, Dr. Javed and other colleagues. And we actually accumulated many things. It is not only the storehouse. We tried to make the module interactive with you. Module will talk to you, right?
Yes.
Module will talk to you. Okay, and we have given these system mock in this way, very interactive. Module will tell you the answer. Module will tell you the explanation. Okay, and you will be able to assess yourself how to proceed further. Okay, for example, if you say the past test or other module, they have given you mock. Okay, one mock of the system, but I think they didn't give you the second mock of the system. So far, I remember. What do you think, Dr. Javed and other, anyone? The repetition to see again, to look at this mock. Is it? I don't know. I'm not sure. But we have given you the second set of the system mock to make it more complete. It is very recent advancement in our module preparation. For this reason, repetition is there, and Dr. Nasser possibly asked you about that. What that, Dr. Nasser, the last one, this
For relevant slides.
relevant slide. Actually, relevant slide given to make the understanding level broader, including beyond the AKT, I like to say. It should not be very secret. Beyond the AKT, if you have any further query to understand the topics, you can go through the relevant slide. But those who are advanced, especially today, we are sitting for the 4 month or less time you are having now with these, you must have some basic knowledge at best from the beforehand regarding the topics. For example, if I go there about the geriatrics, relevant slide actually we discuss in the lecture. Dr. Nasser, what do you think? Almost
Yes.
we discuss the
Yes, sir.
topic in the lecture. If you are attentive to the lecture, okay, in this way you can skip these also. It is true. Again, it is a part of the technique to go through until your target of exam in the coming time. You can skip it. But if you think again that you are little poor about the system, the elderly care or the pediatrics, so don't skip this. So in general, Dr. Nasir, we cannot tell you that you skip all relevant slide of all system. But you are well acquainted, well conversant of the system, you can skip this, not for all. Okay, Dr. Nasir? Not
Yes, sir.
for all.
Thank you.
Right. Any other suggestion, Dr. Nasir? Dr. Javed also can take the place, or any other colleague. We like to hear from other colleagues, those who are preparing, please, to tell us. We like to hear from you today. If no more, we will proceed further for a few minutes for a further guidance. And what we told you that one day before, you just try to be relaxed, okay? And how to read it already, Dr. Javed, please.
Yes. I think what I will just comment on relevant slides. I think better to when you can go through a little faster, because it is a revision of the lecture, basically the lecture you have
Exactly.
seen.
Exactly.
So as you said, the memory will be if you have time. If you short of time, after viewing the lecture, you can skip that. But better to do see that, because it will increase your memory. It will be longer lasting.
Right.
And the repetition of the lecture.
Dr. Javed, you just knocked me to say one new thing also. Just I got in my mind. You just give me a few second time in between, in the middle of your talk. For example, today we are counting 100 days near about, and days will go on. For example,
Yes.
that you are having only 60 or 70 days, 2 months or little more. How to proceed with this module, this interactive dynamic module? As we understood that actually all are repetition somehow. Lecture, relevant slide, solving question, attempt mock, almost the same thing we are mixing with. Okay. But you have even the less time, not 100 days, but you have to touch A to Z of the module. So how you proceed? Listen the lecture and directly go to the system mock. Right, Dr. Javed?
Right.
But not from today. Mind it, not from today. I'm just telling because we may not sit with you after 2 weeks, 3 weeks with the same topic. forward planning, but I don't like to highlight it. My suggestion, humble suggestion, those who are appearing for the exam, try to start from today or tomorrow. Count 100 days with you. Remember it, 100 days with you. So this is also possible. Lecture and the system mock. If you have weakness in the system, again, Dr. Javed said as before, you just go through the learning material or question bank of that system only. It is also possible. And finally, what is done in the previous exam, though it will be very risky, I like to tell you that short journey. We made an the mock module. Those who used before, I'm sorry to say you that I don't know how much it was serving your purpose. We couldn't assess you before, those who used it. This mock module, only the system mock and the recall and the these complete mock. So just it was only with a few amount of subscription fee. Somebody tried their best. Those who are having full of understanding before, the mock module only be utilized by them. Those who don't have the basic understanding, it will be very risky to utilize the mock module 1 or 2 weeks before the exam. We do it. And for technical reason, we will do it also. And it is updated, no doubt, including the latest recall also here. We updated few questions in the mock also according to the system. And sometime I can remember in the last time we took the discussion of the asthma management according to the latest guideline, maybe before the previous AKT exam. Some questions to be modified there. What Dr. Nasser nicely said, there is nothing new to be added in the past medicine. For example, I am not telling by myself, I am just echoing the voice of Dr. Nasser. It could happen. It is not easy to incorporate new thing immediately. Suppose this is prepared for 1 year for this past medicine and others. Nobody is taking care directly in direct contact with you like us. You can imagine, right? It is our pleasure, Alhamdulillah, doctors, that whenever you knock us, we are trying our best to respond to your query and suggestion with our best effort. But it is not possible with the past medicine and other store. So what we are doing, you can see that in the last 5 months, 6 months, we are updating our module here. And we are giving extra messages. Even in the last weeks also, today I like to thank Dr. Javed that Dr. Javed identified there was a mistake in the linking in the module. Okay. And already we have done it. What the topic, Dr. Javed? It was maybe women's health.
Yes, women
right?
health.
Women's health. It is already done, but there is a technical issue. We actually couldn't link the lecture to. So far I can remember. I am still happy to Dr. Javed. May Allah give you the reward to remind us. And we corrected it immediately. Already it is prepared. So with this reference, we request all of you, those who are using our module currently, you collect the module in the group. And inshallah, within after finishing the discussion, we will put the module in the group for each of user, even not enrolled user. You can get it and see even the free buttons. I told you the color, these colors are free button. You can enrich yourself in the whole module. Many buttons are free. So the very latest updated module, including Dr. Nasser also, please look at the group later on. So what I like to say, actually, we are updating this thing almost every 1 to 2 weeks. I think Dr. Javed understood it, and those who are in direct connection in the real time, most of the days, you know, we are reshuffling the button. We are adding some button and removing some button, keeping in the mind to make the module very bulky for you. And it is definitely in our mind. Suppose we have given one lecture of ECG. Whenever we get the updated lecture, we are removing the previous lecture and adding the new lecture here. And it happens. So for example, what you're looking here, these AKT clinical pictures, definitely I remember Dr. Javed and other also, it is very new lecture taken. It is not 6 months before. It is very newly, maybe last 1 month or like this. The clinical pictures in our AKT, there are 2 lectures. And we have accumulated all the previous clinical pictures happen in the last AKT. Together in the same discussion. It's very new lectures, very new lecture. So we are updating it and we are providing you. So my request, my colleague, keep in your eyes in the group regularly so that any new message you can acquire it. And those who are not utilizing the module, you can get it, you download it from the WhatsApp group very easily and look at how much it is useful for you. Dr. Nasir, open the mic maybe.
Yes, sir. And sir, one main thing, if we want to compare and contrast your module with the past medicine, this clinical pictures. There are no too many clinical pictures and over there, and also the lab investigation and recall. Obviously, the recall. What Dr. Ramesh told you, he passed
Oh,
AKT
Dr.
last time.
Ramesh passed the license, a Sri Lankan
Yes, yes.
colleague. Yes,
He
yes.
told me 60 to 70 question came from this. So this is
It
more
is
than enough.
Alhamdulillah, doctor, but I don't like to claim it because it may be more commercial talk that 60-70% to say. But I feel that it will be useful as not as a mentor, as a participant like you in the discussion. I am also gathering my knowledge, doctor, and I am always grateful. And especially in this year, Dr. Nasser, Dr. Javed, and others, how much effort actually we have given to prepare this module. And you know it, and I know because I by myself given the time. It my vision and mission. It is not only that providing some information to you to share, and you know that we have MRCP programs and others also. And even yesterday, maybe my country colleague asked me to guide herself or other, and why you are not giving the discussion for the paces, because we have another mentor for the paces, another colleague. I told them I am very busy with the AKT and the OSCE, because now I am totally with my heart busy with this family medicine, though I am practicing internist in my college for with the MRCP degree. So this is maximum thing, and it may be possible 50 or 60, 70, whatever you said, it will cover maximum, no doubt. Thank you, Dr. Nasir. Dr. Javed, to add something?
Yes, Dr. Nasir, I will just want to add that I myself also studied past medicine while taking MCPS. So past medicine is excellent, no doubt, MCQs, but your concepts will not be clear. Like this one, your module, starting from the lecture and very well organized under one roof. All the things are there.
Thank you,
Past
Dr.
medicine,
Javed. Yeah.
opposite, I mean, like supposedly hypertension, some part treatment will be coming up, cause will be somewhere else. So it's not organized, and your concepts will not be very clear. So it is a part of MCQ is good, but no doubt. But your concepts for the OSCE will not be clear. So for that, I think on overall, this I'm very impressed. This one is your module is, in fact, this AKT will be useful for OSCE as well. Your
Definitely. Yes, that
overall
we
knowledge
told
will
also.
increase.
Yes, because the knowledge part you can cover from AKT. At last, as you said, just to look at this content in a single slide in the screen is a smaller one. I don't know how much you can read it. Dr. Javed, can you read this one? I'm just
Yes.
enlarging a little, All of you can look here. Sorry, just making this slide open for you. Here, especially what Dr. Nasser pointed out, ECGs, that is a masterclass for the rapid learner, you can skip. But again, say in the left column, ECG in AKT, X-ray in AKT. It is very exceptional, so far I understand. If you try to make a contrast compare from the past medicine or others, I think they don't have it in this way. They have only system-wise discussion and intermingling many things. But this thing, very special. And if you learn in this way, what Dr. Javed said now, it will be useful for future OSCE exam. And how many days it will take for the OSCE exam? Technically, you know that if you, by the mercy of Almighty, pass the AKT in this diet, you can appear immediately 4 months or 6 months later in the OSCE. It is possible. There is no bar that you have to spend 1 year or 2 years after passing your part 1 or AKT. So when will you read again ECG and X-ray? So if you learn ECG and X-ray, it is definitely serving both purpose for AKT as well as OSCE. So not only ECG or X-ray, already what Dr. Nasser said, the picture, I think in my preparation, it is very unique. Sorry to say, I didn't actually, as I am searching anywhere, the picture discussion is very exceptional from us. It is not true for you, even in my undergraduate students in my medical college, and even for the MRCP part 2 also. Actually, these are the extract of the MRCP part 2 and mixing with something available in the AKT. So this is that exceptional thing, AKT, ECG and other things. And it is mandatory, including few touch of the fundoscopy. And you remember that few questions appear in the fundoscopy. Even in the OSCE also, you need to identify the pictures of the fundoscopy, and they are coming in future. And you know that the South Asian exam are not as before, 10 years before. UK, Australia approved these MRCGP, South Asia. What is the reason? It is already updated and making an equivalent level of quality with the MRCGP UK. For this reason, you need to know it. You cannot skip it, that fundoscopy. If anybody here for the MRCP aspirant, you know that the picture, X-ray, ECG actually part of the MRCP part 2 written, but it is incorporated in MRCGP in the part 1. This is the glamour and extraordinary quality of the AKT. So don't think that it is MRCGP part 1 is equivalent of MRCP part 1. I like to say the MRCGP, that is the AKT part 1, is more bulky than MRCP part 1. I know it because you know that my career in the MRCP as well. For this reason, give it more importance, and it will give you preparation, hints, quality, not only for AKT, it will give you preparation quality for the OSCE. I just expanded the opinion of Dr. Javed. So I think we like to finish it now. You see many other things here. And this is the books given, again, keeping in the mind, not make you bulky. Very minimum thing we put here, maybe one book or something, few PDFs could be. And in future, just last words for you, that we will be updating at our best effort. Even every week, minimum within 2 weeks, you are getting the updates. So my humble request to all of you, those who are using the module, keep your eyes in the group, because we may not give you individually one module. It will be not for time saving or cost time effective. So we believe that you keep your eyes in the group, so that anytime we will make the version number in future. We already prepared for the OSCE version 5, but we will count how many. Actually, we didn't mark as version. We will give a version maybe 5, more than 5 here or 6, so that you can compare what with you, and so that latest version always try to collect. With these words, we like to conclude our technical learning journey. And finally, if you don't have thing, as a part of our what I say, the commercial, rather to say, you can say the commercial messages for the participant of MRCGP exam. In there, we are actually utilizing the 30 USD reduction for you, especially for the AKT examinee for coming coming diet. Otherwise,
Sir,
yeah, Dr. Nasir,
last ending words.
please.
Actually, sir, one of my friend, he is in UK, and he sent some link. There are two teacher over there,
Okay.
Aman Arora, and other one is MD Mayuddin. They are
Okay.
also teaching MRCGP, and they are also claiming that they are also cover this MRCGP International.
Fine.
But I saw their module, not the full one, the little version.
Okay.
Okay, it is good for the UK, but as far as the MRCGP International is concerned, your model is more than enough and much better than both of these.
Thanking you, Doctor. But as well, for example, those who are utilizing this module also, our also intention to expand it in future compatible for the MRCGP UK. This plan already in our hand. Just keep us in your prayer. For other colleagues, those who are planning for the MRCGP UK, we will improve it, keeping the structure unaltered. Okay, we will not destroy or disrupt the structure compatible for the MRCGP South Asia. Keeping it intact, will expand it with other materials compatible for the MRCGP UK. Already the plan is with our hand. So it can be utilized for others as well, not. So, okay, Dr. Nasir, thanking you. We like to finish. Many minutes you were with us. And this is already invitation for you. Try to communicate with us personally to get the advantage. But in general, those who are not appearing in this current exam, coming exam, you can utilize this module according to your planning. 12 months, 9 months, 6 months, 4 months, not. We're giving this, highlighting 4 months for the coming exam. But better, we tell you that go slow is better all the time. So thanking you and gratitude to all of you for patient hearing. Today is very
Sir, so very
special.
nice.
and technical discussion rather. Okay, don't mind that we didn't discuss the hypertension, diabetes, or other topic. This technical thing is in hidden issues. If you don't have the technique, whatever you are learning, you may not get a success. For this is also important for the technical understanding. And it will be increasing. You see, more than 76 nowadays, maybe 78 or 80 near about lectures are there. So it will be increasing more and more in future. So be with us, and for that we are telling this is a dynamic module, not a static like others rather to say. It is a dynamic, and we'll make it dynamic in future by the mercy of Almighty all the time. So keep in touch, and thank you very much for your participation. Keep your eyes in the group, doctor. Keep your eyes in the group. Best of luck. Assalamu everyone.
Thank you.
Thank you.
Welcome.